So, in trying to navigate through the healthcare system, there are one or two differences that we come across and all of that. So, this is the language barriers, okay, in gynecology cares, especially in Africa, where you could see that in a single state, okay, that's a single state in a country, the state is having over 200 tribes. Talk less of the whole country be having like over 800 to 700 tribes. So language barrier is a thing that healthcare providers would come across in trying to deliver for healthcare. Now, on the side of the healthcare provider, he's not able to, like, maybe there's a prevention for a particular disease, okay? Now he's not being able to communicate it very well to the person. So on the patient side, maybe the patient is not being able to express their self well. So most of the times they have to now resolve into using an interpreter, okay? So that the interpreter is listening to what any of the parties is saying and is conveying it to any of the party. So it can significantly impact patient safety, because if I'm just supposed to tell a patient a very simple thing and I'm not able to communicate that, let me say something like, please stop drinking dirty water from that stream, because maybe people come with cows to like feed in the stream and all of that. I'm not able to communicate this thing solely. Only that dirty water can serve as one of the reasons why the patient can die later. Do you understand? So it's mostly needed, or it mostly affects areas like reproductive health, pregnancies and childbirth, okay? As gynecology, this is where we'll be focusing. So when patients and providers can share a common language, misunderstandings can lead to misdiagnosis. All right, so I'm not able to communicate to a patient, so I'm not able to communicate the right, I'm not able to pick up the right diagnosis, okay? Because the patient, from medical history only, what I'm asking you and answering can help me know a lot. So how the language barriers can actually affect gynecological care? It can cause a miscommunication of symptoms, how a patient is feeling. All right, informed consent challenges. Maybe sometimes I want to give you several options that are available for you to check, for you to choose. Now, you might choose an option that you didn't actually understand very well. Yes, you chose it, but that wasn't really what you wanted if you had understand better. So there's reduced trust and rapport. You can't really be friends on 100 with your patients, okay? It can lead to medication errors. It can lead to delayed care or missed care totally. So solutions to language concordance care is, you as a healthcare professional, where you find yourself, at least tell anyone or two, okay, at least the greetings of the people, you should learn it. All right, the professional interpreter should be here. You can see this woman is interpreting from the doctor, all right, to the patient. Then what again? Translated materials, visual aids and diagrams. Then cultural navigations or duolas. So ethical legal consideration is, patient have a legal right to language access, okay? Ad hoc interpreters, as like family members, may be used in emergencies. All right, providers must document language preference and interpreters using medical records.